Hello, this is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about root cause medicine. And what do I mean by that? Well, much of medicine today and probably for the last couple hundred years has been largely just putting band-aids on symptoms. And what I mean by that is if you go to your doctor and you say, oh, I have the pain in my ankle or pain in my hip, they'll tell you to take Tylenol or aspirin, which just masks the symptoms. It just masks the real problem. And although it does help you function, it doesn't really help you figure out, why am I having this problem? And so one of the things that we pride ourselves here in my practice is we practice root cause medicine. We look for the root causes of a myriad of different symptoms that are typically presented in a patient who has complex chronic illness. Complex chronic illness can be the result of tick-borne illness, vector-borne illness, mold illness, glyphosate exposure, environmental exposure, heavy metals, allergies, a whole myriad of different causes that can actually work together to bring about a constellation of symptoms that is specific for you. In addition to which, your genome, your genes, are very important in the development of complex chronic illness and disease. What do I mean by that? Well, your genome and your genes are contained within your cells in the nucleus, and they are arranged on 23 pairs of chromosomes. And we have millions of genes, and they work together to make you who you are genetically. And then those genetics get modified epigenomically, epi meaning on genes, by the environment. So what do I mean by that? Well, let's take Lyme disease. Lyme disease is an intracellular infection. So it pierces the lipid bilayer of a cell on its way into the cell. It enters the nucleus, and it is disruptive to the genes in the nucleus. So what do I mean by that? Well, it can turn on and off genes. For example, oncogenes. Oncogenes are present in some cancers. It can turn on and off oncogenes. It can turn off inflammatory genes. It can turn on inflammatory genes. It can turn on a host of cytokines. That's what we've seen in COVID. My point is this, is personalized medicine and root cause medicine take into consideration your genome, your history of illness, and your genetic history. What do your parents have? What do your grandparents have? And because all of this is influential to the manifestation of the disease that you present with. For example, if you have a family history of diabetes, you are at far greater risk for developing diabetes within the complex chronic illness model when you have a genetic predisposition. Now, this shouldn't come as any great surprise. It's common sense. Most doctors will look at your heritage to help get clues about where we should look for things. And it helps us figure out sort of what is the role of your genome in the manifestation of the symptoms of the disease for which you're presenting. So root cause medicine looks at a variety of different issues, and that means a lot of tests. And I know that it's expensive, and I know that it's difficult, but it is the most accurate way to document and demonstrate what is going on in your physiology that's contributing to your illness. And we do a lot of testing in my office. Obviously, if you don't want to do it, you don't have to do it. But I do find that most patients are glad that they did it because it gives them a window to view what's going on with their body, and they generally appreciate that. So root cause medicine is something that we do in my office with every patient in a personalized manner. And if you would like to become a patient, please give my office a call at 206-299-2676, and we'd be happy to service you. I hope you have a wonderful day. Take care.